Hi, I'm Lori.
And I'm Kevin, and this is No Longer Ashamed.
We are survivors of childhood sexual abuse.
And we're here to share with you that if you're a survivor, you don't have to be alone.
Our logo is a salamander, and the reason is a fire salamander can survive a fire, and you have survived a fire.
We want to help you with your journey to healing and hope.
We are all survivors together, and we walk this journey together, and you are not alone.
By telling our stories, we are hoping that you will have the courage to share your stories as well and find your voice.
Because stories are so important, and for so long I know that I wouldn't tell my story, but when I finally shared my story, that's when I got my freedom.
And this is our journey and your journey to healing and hope. So come with us.
And I'm very excited to have our guest. He was actually a guest of mine on my podcast called Spotlight. And the reason that I was so intrigued was that there's a procedure that Kevin has had done. And we're going to talk about that, but it's one that I have been thinking about. And also, Kevin, I think I said this, I've been thinking about it for my granddaughter who's been adopted out of foster care. But Kevin was a California State Patrol officer, and his beat was the Golden Gate Bridge. Is that right?
Yes.
And yes. He saved over 200 lives from suicide. And, you know, it's interesting, Kevin, because I work as a recovery coach, and so often we hear stories in our recovery community that amaze me because they were ready to jump off a bridge. Here we have the Aurora Bridge, and just so happened a policeman came by and changed everything. So I have so much admiration because I have friends that would not be here today had it not been for the patrolman of that bridge. Yeah. And I can't imagine, I'm sure that you probably witnessed things that...
Yes, unfortunately, yes.
Which is probably why you chose to get this trauma procedure. So I don't know where you'd like to start. If you want to start with the procedure or start with what brought you to this. We'll
sure.
Throw it to you, but thank you so much for being with us today.
Oh, absolutely. My pleasure. Well, I'll tell you a couple of different things. The things that really haunt me are things that happened when I was a child. Some severe, I'll just put it as abuse by a neighbor when I was very young, probably 8 to 10 years old. And I would have a face many nights during the week that would be right up against mine when I would try to sleep. Mm-hmm. And it would just haunt me, and it wouldn't go away. I tried EMDR, eye movement desensitization and reprocessing, and that helped. You know, that's a really cool thing, and I tell folks to look at that. There's a whole gamut of things. Try talk therapy. You know, let's work our way up and see how things go. Dr. Shauna Springer reached out to me and asked me if I've ever heard of this stellate ganglion block. Whoa, those are, at least two of those words are way past my vocabulary. I go, my biggest word is mayonnaise, okay? That's way past me. And I spell it M-A-Y-O. So she talked about it, and I read about it and researched it. Mm-hmm. And what it entails is getting an injection in your neck. And actually, I had two of them on the right side of my neck. And it kind of freaks people out. Oh, injections in the neck? No, hell no, we're not doing that. It was nothing. I've had a lot of surgeries. If we went through my history, you'd be, oh my God, what a mess. But this was nothing. The folks where I had this done down in San Jose, California, they were so nice and explained everything to me. Sat down, and I didn't even get the regular anesthesia that you get. They said, hey, you know, if you want, try this. And some other folks who had tried it, including Dr. Shauna Springer, was there. She came there because she had some patients going to be there, including me. Mm-hmm. So she said, Kevin, this is what I did. She goes, I want you to choose, of course. But I'm just going to tell you how it went for me and the different things. So everything was fully explained. I went with just a very local anesthesia in the right side of my neck. And it was fine. I went through the procedure, which was maybe 15 minutes, 20 minutes, something like that. We actually got permission to video it. So I'm trying to put together a video for this. It's kind of cool.
I did watch the video.
Great. It was, yeah. So you see, actually what was interesting was my blood pressure, because I have very high blood pressure. I take a lot of medication, but it was going down during the procedure, which is kind of weird.
I know. I heard Shauna say that.
Yes.
And, you know, I have this big fear of needles. I didn't know if I could watch it, but because of meeting you, I wanted to. I wanted to honor you by doing that because you have done this big thing. Just hearing you say that it was okay.
It was fine. All I really felt was it felt like some pressure on the collarbone part right here, clavicle. That's what it felt like to me. It was a very smooth process. I had very little after effects, which went away rapidly. I think my eye drooped a little bit from this, but nothing. Everything was gone within a few hours.
Did you have the other side done yet?
I'm going to have that done next month. I believe towards the end of next month.
So I know that we had talked a little bit about, I'd kind of like to know what the difference is. You had some hopes about those dreams. And so can you tell us?
Yes. So what I have seen is my concentration has been a little better. And who knows whether that's just me or the effects of this, but all I can say is this is what's been happening in the past couple of weeks because it's been a short time. I think I'm less irritable. I can get kind of cranky, and
look
then
at that face, you get cranky.
And then what I have seen, and this is very strange, I may be an anomaly, the first one that's had this happen to, but when I explain this, it sounds funny, but it works. So the face doesn't come as often as it did. And when it does, it comes on and it latches on like a crab latching onto your face. But then it's strange. It's like here comes a single card in a deck of cards, and that face is captured on that card, and then that card is just whisked away.
Wow.
Really?
It's very, very strange, but that's what's happening with me. I'll take it. it.
What are the emotional feelings? I mean, I know it sounds like you were having night terrors. Is that what you would call it before?
These would happen when I'm awake.
Oh.
So I just couldn't sleep because of this face, and less than an inch from my face. And it would just keep me up for hours.
So what were your emotional feelings at the time that you were having them before as compared to now?
Oh,
it was terrible. I didn't talk about this for decades, and I still don't talk about it. In my presentations that I do, I just tell you, about the same what I told you folks. This is kind of what happened. It's very difficult for me to dig into.
Yeah. There's a statistic, Kevin, you probably know this, but most people who have had childhood trauma like that, it takes over 26 years before they're able to share. And Kevin and I, we're always like, and the statute of limitation is 7 years.
Yeah. In many states. So it's ridiculous. I mean,
but this has helped me, and I'm looking forward to doing the other side. Suppose what I've heard was the left side is more for childhood trauma. So that should be interesting.
Because this has been sort of, for Shauna, has been a veterans. That's been her focus. Yes. And so when you think about their trauma, it would be
more adult.
So that's very interesting.
So that's more geared towards PTSD for veterans and like in your experience, being in the forces, the police forces and so forth.
Yeah.
Right. And I see things, the folks that I have lost, I see them falling from the bridge. But in my own mind, I don't think that bothers me as much as that face does.
Yeah. Well, and I think too, when we recognize childhood abuse as an adult, it's hard to kind of make that distinction that, wait a minute, we were a child, because we're, facing it as an adult. And so we think we could have had more power. We could have done something. And we interviewed a great psychiatrist, Dr. Doug Carpenter, and he talked about just how difficult it is for men and boys to finally come forward, because there is just so much just guilt and shame and feeling like they could have done something,
or feeling like they should have been able to do something. But as children, we're helpless. We're unable to control our situation. But when we get older, we feel like we should have been able to.
Yes, we're the fixers. We're the one that when anybody wants to talk to us, and I teach this to folks, is generally we don't listen as well. We're going to fix whatever's ailing you, whether that's right or wrong. Probably when it comes to mental health, it's probably wrong. But the sooner we realize that, the better.
I teach people to become coaches. And I always say, nobody ever asks for unsolicited advice. But it is true that about the listening. And so I'm curious, as you have now, you're kind of moving on with your life, and you do this program, you speak and you talk about it's suicide prevention. Is that correct?
Yes. Negotiations, suicide prevention, quality of life. Yes.
Can you talk a little bit about that? Because probably a lot of people that want to commit suicide have childhood trauma. Would you say that?
That can be a big part of it. Mm-hmm. Yes. So, I talk about, I have 2 boys, and my oldest boy is now 21. When he was 14, he was suicidal.
Oh.
So I talk about what he went through and how here I am, the guy going out teaching it, and I'm missing the signs and things that he's showing.
Oh, wow. So while you were teaching.
While I'm teaching, this is happening at home. Yeah. And this is what's happening with so many folks is either they're working a job or multiple jobs. They're so busy helping others and trying to get the buck and everything else, chasing the dollar, that we miss our own quality of life and our family's quality of life. So I go through all the different things that I have been through with head injuries, heart surgeries. I had cancer when I was 20 years old through those multiple surgeries and the chemotherapy and all. And then my mother dying at just age 49 back in 1989 and having that in front of me and closing her eyes, how all these things affect you and how it affected me. And I didn't see it, nor did I want to acknowledge it because I had these macho jobs. I was in the Army, jumped out of planes, worked at San Quentin, highway patrol, motor sergeant, all these macho jobs where you don't show a weakness.
Yeah.
Wow. Could you say a little more about that? Because I think that is something that I see as a coach. I see that, especially with men, is like, I've got to be positive. I've got to be on top of it, because if I show weakness, it's almost like I'll die.
Yeah. So here's what happened to me throughout the years of not taking care of myself. Now, I was big into bodybuilding until I had these heart issues. And then kind of, you got to get skinnier. So, but what happened was I could go to work and function and fine. Everything was great. But I had days when I would come home, and mind you, we would get 3 days off at a time with the highway patrol. When I would come home, sometimes I wouldn't leave the house for 3 days. And now I'm divorced. My boys are about 10 miles away from me with my ex-wife, and we have a great relationship. I'm down there a lot, but I didn't want to see them. I didn't want to walk the dogs. I didn't want to go outside. And I was debating this for years. How can I go to work and function at 100% and be fine, and then go home? Some days, okay. Other days, I'm not going to leave the house. I'm not even going to leave the couch.
Yeah.
So I suffered through this for a long time before I went to my regular doctor and told him, I think life's kind of passing me up. So he had me take the test, which a lot of people are familiar with. It's called PHQ-9, Patient Health Questionnaire 9, and it's a screen for depression. 9 questions is all. I took that test, and I was I thought about every single question, and I was truthful with it. And he came walking in the room with it, and he goes, "Kevin, you have depression. How do you feel about that?" I'm like, Jesus, I got all this heart issues, testicular cancer at 20. I'm just getting beat up here.
You're like, I don't have time for depression.
So we put me on a medication. And here's what I want folks to really realize too, that it was okay, but it didn't work too well for me. And I got to the point where I wanted to see a psychologist. Yeah. So I emailed this same doctor. And I told him, "Doc, I am not suicidal, but I've had a lot of things happen in my life, and I'd like to see someone in the mental health profession." Well, he wrote me back and said, "Because you're not an imminent threat to yourself, pretty much I don't recommend you do this."
Really?
Wow, what a slap in the face.
I mean, that was really brave of you to do that, because, I know even for me to reach out was hard. Yeah. And then for him to say, "You don't need this." Wow.
That's crazy.
He said something, and I have the letter. I should have had it here with me to read it to you. But he didn't say I don't recommend it, but he said, "Doesn't sound like you're any imminent threat. If you decide to do this, here's their number, best wishes," kind of thing. And I thought, boy, what a slap in the face. And I'd been with this doctor a very long time. So I did it anyway. And I'm very glad I did. And I'm telling everybody, if you get a letter like that, to do it anyway, because this is your mental health. That makes me so angry.
Yeah.
So I went and saw a psychiatrist very first time. And this lady was wonderful. because this is what I did. I did negotiations. So I study it. I read it. I love to learn about it. I've talked with a lot of doctors, a lot of negotiators, a lot of people on the other side of the rail. I'm here to learn. So this is what I was looking for, is what she did. She had her desk. She sits behind her desk, but she had me sit on the side. So there was no barrier between us. I love that. And I preach that. I hate barriers.
Yes.
And she just sat there and listened. She didn't tape record it. She wasn't writing notes. She had to clarify things before we actually got into the stuff. And she didn't press me. She goes, would you like to talk more about that? And I said, not at this time. Okay, fine. Great. She was very, very kind and said, here's some things that we can do. So she recommended EMDR. So I tried that, and it seemed to be very interesting, and it did help.
Yeah.
And then it was years later when I went to the Stellate Ganglion block, and we're trying this. And what's nice is I tell folks, let me be the guinea pig and tell you how it went for me. Now, it's going to vary based on everybody. We all have different experiences, but at least I can tell them how my procedure went and what it was like and all that.
Yeah. Yeah. In fact, we will put in the show notes, because you have an interview with Dr. Shauna and about this. And I want to put that podcast on there. But for me, I've mentioned it to Kevin. I've actually mentioned it to some family members who sort of blow me off. But when I first interviewed Dr. Shauna on my radio show, I actually cried when I heard her talking about this procedure, because the hypervigilance, I think that people may not realize, when you have early childhood trauma, the hypervigilance that comes with that you're always on guard, because things happen to you at an age that shouldn't, and you are not protected. So now you spend a lifetime trying to figure out how to protect yourself. And so when my granddaughter, who's in foster care, we don't know what happened to her, but she's 6, she can push my buttons. And my older granddaughter, who's not adopted, if the same thing happened, she'd be like, Grandma, I'm so sorry. This one's like, ooh, I got you, and it just makes me think of just how trauma as a child affects that early childhood development. And like, I look at, you went on to be a state patrolman, you went on to have a good life, but it doesn't mean that didn't affect you.
Right. And when we're talking about hypervigilance, I don't talk about that much, because that was my way of life.
Right.
Being on the patrol and riding a motorcycle, if you're not vigilant, you're not going home.
You're not.
So in my home, I have, be honest with you, I have weapons planted in different places. I've always been hypervigilant, but that's the lifestyle I chose.
Yeah. I think for men, sometimes male survivors overcompensate by, like you were saying, the bodybuilding, the beefing up. You become super macho because you're not going to let this ever happen again. And so you're going to be the one that's in control. You're going to take control of your life and not let anyone ever do this again, but you're still hurting because you're not addressing what happened to you. You're just becoming this, we call them the masks or the walls. You put up this mask of this big macho tough guy, but inside you're still that scared little kid that's been hurt.
There was a phrase I learned early on in my recovery. It was called sinful, which sounds really awful, but sinful self-protection. It's like we work so hard to protect ourselves that we shut everybody out. And that's what Kevin said with the walls.
And I see that, and I see that with me. I don't allow a lot of people in. The ones that I do, I hang around a lot with. I go to coffee probably 4 times a week with these folks, and it's my little tribe. Donna says, where's your tribe? Have a tribe. I like that. So this is my tribe, and we let certain folks in, and it's just my way. Now, whether that's been because of the things that have happened, it certainly could be. I like what you talked about with the bodybuilding and being your own protective barrier against this outside world and this force and these things that have happened. That makes a lot of sense to me. And I will tell you, when the doctor came in with my heart surgeries, I had 3 heart surgeries back when I was 47. And he said, I don't want you lifting any more than like 20 pounds. It stunningly hurt me because I was no longer going to be big and large. And that it really wrecked me. It took a long time to recover from that. because I was so used to lifting all the time. And I passed up a lot of things. And I passed up camping trips, other different things, because I would have to be in the gym. I never competed. It was just for me. And I always wore long sleeve. Wasn't a showy type. But, when that doctor said that, we talked about what happens if you get into trauma and different things that happen. Sometimes it's the words that we say more than the operations. I had 3 operations on my heart through the femoral arteries, and they were nothing. It was nothing. But the doctor coming in and telling me, Kevin, there's something wrong with your heart.
No.
We're going to try to find out what it is. So then I'm thinking, am I going to see my kids again?
Yeah.
Because all my hospital stays, which have been numerous, I haven't told my 2 boys that I'm in the hospital. I don't want them coming to see me.
Interesting. How do they feel about that? Like, did they find out later?
Yes. My grandfather was the same way. He got electrocuted at a line, and it blew off his arms. He had to take his arms, and severely electrocuted. But he wouldn't let the kids come in and see him. And he was in the hospital months and months and months. This was decades, going to 30s. But he came back and studied very hard and became a judge after that. So we look at, the things that have happened to us. He was then gravely injured, and he came back and he studied hard. So I think there's a lot of my grandfather in me that I don't want my kids seeing a weakness in me.
Yeah. It sounds like in your presentations and what you're doing now with your life is a lot about sharing your story. And what would you say to somebody listening who's maybe they say, oh, maybe I had childhood trauma, but they really can't talk about it? What would you suggest to people in order for them to move on and to actually embrace and live their life?
To start out with something. If you can't tell someone, how about writing it down for you? Make notes about, this is how I'm feeling. This is what happened. And then there it is in black and white, so to speak. This is what happened. Okay, maybe I don't want to talk about it right now, but save that. If you can't talk about it, maybe you can see a mental health professional, but see one that's trained in whatever happened to you. I can't stress that enough. Too many times I've seen officers go through traumas and they went to a mental health professional who wasn't trained in what they did. And we did this with my boy. This gentleman was not trained in suicide assessment, and it was horrible. So make sure that individual is trained in what you're going to see them for.
How do we do that, Kevin? How do we find the right person?
I would ask them, or ask the health organization that you're with. Or even better, if you can't do it, you have someone that you can confide in, or through an email. Are they trained in this?
Yeah.
So, I'm always asked for advice on things, and I tell folks I am not a mental health professional. I get to speak with a lot of them, and I continue to do. I think I told you, when I'm not traveling 2 and 3 days a week, I'll work at my local schools, and I get to speak with a lot of mental health professionals. And kids are tough, boy. I'm exhausted when I get work with that. I was there today. I'm falling asleep at 5:00. I'm falling asleep. They run me ragged, but you learn a lot.
You mentor these kids, right?
Yes. And it's all grade levels, 13 schools, with 2 high schools in there.
Yeah. Mentoring is such an important thing. And I think that there's sort of this age group a little older than me that was the hippies. And they're like, we didn't want to hear from adults. We're not going to try to mentor people. But I feel like my daughter in California, she's in Redding, and she's got a mentoring program because Sacramento sent all their homeless people to Redding. And now they've got all these kids that are in foster care or homeless, but going to school. So she's created a curriculum for this mentoring program. And it's like all it takes to mentor is to go and to be. And it's such a simple thing to do, but people seem to think like it's like there's so much expected of them. But the fact that you go and you're with these kids, it makes such a difference when an adult cares about a kid.
It does. If you're there for them, don't do it to get something on your resume. I always tell folks when I talk, this is not the Kevin Briggs show. When I was up on the bridge, working on the Golden Gate Bridge, it was not the Kevin Briggs show. It wasn't, well, how can I save this person? Absolutely not. It's always about them.
Yeah.
It really is, and what can we do to help them? And that's the biggest thing. If you make it about them and you're there to listen and keep in your mind, 2 ears and 1 mouth, start with that.
Yeah.
You're going to listen more. You're going to listen.
Yeah. And, it's like when you think about kids, they'll be kind of shut off, or they'll be they don't see the value in it. But then when you are willing to listen and be interested in them, that's when it like opens the door. They may come in, like my daughter says, they'll come in with their hood on and they're like, whatever. But then somebody is interested in them. And just like you said, listening, it's not about the mentor, it's about the student. And that breakthrough of them realizing, oh, you actually care about me.
And that may take several times of going to visit with them. I've found that out working with some kids, especially the very, well, I'm going to say all the ranges of age, but I've really seen it with younger kids that it takes a while before they're going to even slightly trust you. And now I work with a few, and when I get there, hey, Kevin's here. And it's really, now they may not listen and they may run for me and everything else, but hey, Kevin's here. So we take it day by day.
Yeah. I always, when I was a single mom, and so when I raised my kids, I always felt like any adult that showed interest in my kids, that valued them, that it meant so much to me as a mom. But I know late now that they're in their 30s, that it made a difference because they realized that other adults did care about them.
Yeah.
I would say so. I was scared of kids most of my life. These little creatures, they're frightening. Yeah. I've learned a lot. I've been doing this, speaking since 2013, but working with kids at the schools for 3 years now. This is my third year doing it. And I've learned a tremendous amount, not only about them, but about myself. And you need to have a lot of patience working with kids. You really do. So I've always needed to build my patience. So,
it's that kind of that generation gap I see, like even at my work. So when I trained in radio, you say because, you don't say, you don't say, and these kids come in today and they've gone to broadcast school, but they're like, hey, I got a few minutes to talk to you about this and you are going to listen. And I'm like, and it's such a different thing, but I learned because I'm willing to just like enjoy them instead of be like, wait, that's not how you do broadcasting. So it's such a good point. Well, I just feel like if you had something that you would want to say to people, you've experienced so much in your adult life, in your childhood, in your adult life of trauma, as well as learning and understanding trauma. What would you want to say to people?
I would like to tell folks, first off, take care of yourself. So many of us are continually putting out for others. Let's start with ourselves for a while, or at least equal to giving out to other folks. So take care of yourself and your family, and then let the rest follow. And when you're having a conversation with someone that could turn into high end or is high end right from the start, be there to listen. From the first conversation, don't try to fix things. Just be there and listen. And I say 80, 20, 70, 30. Let them talk 70% of the time and you 30. Your time will come later on down the line, maybe in a whole other conversation, several weeks from now even. But just listen and you'd be amazed. Folks want to talk. And a perfect example is Kevin Berthia, the gentleman who was over the rail, the black man over the rail. I listened to him for about 90 minutes. I spoke for just very small amount of time. And he came back over, not because I fixed anything, because I listened. So that's what I would tell folks is we all need to listen better. And I'm still working on it, work in progress, but I know that I need to work on it, and I am working on it.
I teach coaching, and that was the biggest thing is I let myself be the client, and I had a situation and I let them coach me and they wanted to fix me. And, it's an insult to fix people because it says, I don't think you have thought through this. And most people have thought through every single scenario. And so giving somebody the space for them to talk helps them solve their own problem because they are the expert on themselves.
Yeah.
I think so. And I agree with you 100%, and it allows them to vent. And we know all of us have been very, very angry at times when allowed to vent and not told what to do. I should have done this or prosecuted in some way. We feel so much better.
Yeah.
I think conversely is also true. If you are a survivor and you've never talked about it, but it's affecting you so much, what you need is to talk about, is to get it out, to be able to express it somehow. Of course, it has to be in a safe setting with someone you feel safe with. But just as you're saying, listening is so important. Well, for the person who's hurting, to be heard, to actually have someone care enough to let them express what they're going through, what they've been through, and how they're dealing with it or not dealing with it. That's so important.
Yes, what you say to the person, if they choose you to come up and say, 20 years ago, I was raped, for a young woman or something along those lines, to really sit and take that all in. Wow, that had to be tremendously difficult for you and still continue for you. I want to let you know, first off, thank you for telling me this. And I want to let you know that I'm here for you. Anything that you need, I can throw some things out there that maybe you would like to try. If I know them, if I do know them. If not, wow. Yeah. I'd be happy to go with this together with you. Thank you for choosing me to tell this to. Wow. So don't try to fix it, but to be there for them.
Yeah. I think so many survivors just want to be listened to and also believed. Right. It's, often people dismiss it or say, well, why did it take you so long to talk about it? Or, so many things. That's a whole nother show.
Yeah, so many things. That hasn't happened to me, to where somebody said, what are you looking for attention? Yeah. And I've only very recently started coming out with this, just this micro bit that I'm ready to talk about. And to be honest with you, if somebody said, I don't care whether you believe me or not, you don't have the horrors that I have at night. And I know other people that he abused on this street. One gentleman lost their life to suicide. None of them became very successful. He ruined lives.
Yeah, I think what we use in order to cope affects us all our lives, unless we actually start to look at what happened to us and talk about and deal with it. Otherwise, we're just using those coping mechanisms all our lives. And those coping mechanisms worked when we were young. I mean, they helped us survive, but as we get older, they don't work anymore and they start to cripple us. The coping mechanisms I had when I was younger wouldn't serve me well now. I mean, they were mostly drugs and alcohol, and
the wrong ones. Coming down to even hugging, I have a very difficult time with that. And I attribute it to what occurred.
Yeah. And a lot of times we don't realize the triggers that we have because we just avoid them. But we don't realize where those triggers are coming from or how they're affecting us. We just stay away from them. And the thing about triggers is, unless you're aware of them, unless you know what they are, they keep affecting us. But the more awareness we have, then we can start to learn how to deal with them, and they don't trigger us. I mean, they still trigger us, but we learn how to deal with that trigger in a healthy manner.
Right. So one of the things for me was my girlfriend and I, my neighbor, one of us always had a broken down car. So we would do errands together. And one time we were driving down the road and I saw this old man. Now, I was probably 30 at the time, so he was probably 50, not that old.
Yeah, you're
but,
sorry.
But I said, oh my gosh, I just want to run over that man. And she was like mortified. She's like, what are you talking about? I just want to go hold his hand and help him get his mail. And that was for me, I realized, because it was an older man and I wanted to kill all older men. But so, it's like those triggers and then recognizing it. And I remember that listening to her saying, oh, old men are so sweet. I just remember like the confusion in my brain of like, what? Yeah. So it's like paying attention to those things and then realizing, oh, there's something to that.
Yeah.
Yeah.
I don't know if this is how you feel, but I know for me, I think being a survivor has helped me be more empathetic towards people. And I wonder if that's what kind of helped you in what you were doing when you were in the patrol.
I think so for me, because I have to go through things, unfortunately, to understand them. So with the abuse and then the testicular cancer, my mom dying when I was young, the head injuries, and then these hospitalizations for the heart and all these different things. So it's experiences and kind of crappy ones. And I tell folks, when I'm talking to someone over the rail on that bridge, I wouldn't bring up all this stuff because I want it to be about them.
Yeah.
And I don't want to compare my situations unless they bring it up. If they say, well, you don't know what it's like to have cancer. Unfortunately, I do. Now we can talk about that if they want. I'll be happy to share with you the chemotherapies that I had, the hair that I lost, my attitude, the throwing up, the resentment, the trying to talk the doctor. All I had was $2,000 to my name, trying to talk the doctor out of the last course of chemo to give them $2,000. And they sent me to the psychiatrist. So, but that's the thing is making it about them and as comfortable as I can to allow them to talk. So if there's things we have in common and they will listen, I do want to hear about it, I'm happy to share it. But the more that they talk, the more information I get, and the better rapport I can build. So when it does get to that point to where I want to influence that behavioral change, I'm going to have better rapport and hopefully a better outcome.
Right. And you're trained in negotiations. So it's something that, you've learned. But also, I love it that you're like, I tried the EMDR, which a lot of people use and is successful. But sometimes it's not enough. And that, what I really appreciate about your story is that you kept going. You kept trying new things, that you were committed to that. And I think that as me looking at you as a guinea pig,
and I'm fine with it,
is that we don't stop. We keep learning, we keep growing, we keep trying to get well, we keep trying to find things that will work, and that it is such a process.
It is. Continue to grow, continue to read and study. And I say that as I watch TV way too many hours a week. But
I'm kind of curious now, the work you do with kids when you go to schools and stuff, what do you talk about with them?
Whatever they want to talk about, because a lot of times these kids are from broken families and they're really struggling. They have angry, and some are very violent. The small ones have been very, very violent. I've had scissors coming at me and all sorts of things from these first graders. So it's more about trying to develop that rapport. And this is not a negotiation. They are in charge. That's for sure. I'm trying all the tricks that I'm asking mental health professionals with some tricks. Doesn't matter. They're in charge.
I love it.
Time and time again, they walk away from me. Hey, come on. Nothing. No. So to just be there, and I try not to, unless I'm really told to take hold of these kids, unless they're really doing something wrong. I try not to touch that. I don't want that.
Yeah.
That can leave, lasting effects, and it just doesn't go well for anything. Parents get mad. Everybody gets mad. So I just want to be a couple of feet between us, having a conversation, and many, many times, give it a couple times. Hey, Kevin, how are you? And I say, what you got going on this weekend? And then they'll tell me the different things, and we start to develop a rapport. So maybe I'll see them once a week, twice a week, but we'll just have chats for maybe 15 minutes, relatively short. And I said, all right, buddy, I'll see you. Okay. And I'll tell them, make good choices. Think about yourself. So I'll leave them with a little something, but try to find out what's going on with them is what I'm really trying to do. Build that rapport so they can trust me and they can talk to me. So if something really nasty is going on, maybe they can tell me, but I also want to be a friend. Let them know you can tell me anything. Hey, Kevin, man, we went to the zoo and we did this. Great. It's just somebody for them to talk to that they don't have to worry about. So
it sounds a lot like what you probably did with the people on the bridge.
It is, but it's shorter time spans and multiples of it.
Yeah. I mean, obviously the consequences or the possible consequences are a lot more.
Yes.
With the people on the bridge, you want to keep them talking.
Yeah.
Yes. Yeah. No, that's what it's about is, being there for someone. So it took me quite a bit to learn how to be comfortable around kids, as I wasn't too used to that. They're scary little creatures. So
yeah, I always had a fear of kids when I was younger, and at the same time I wanted to be a teacher, but I was afraid kids could see my secrets or they could know something was wrong with me. I always felt like they knew something was wrong with me.
Interesting.
And
I think they sense things. I think they sense things a lot more times than adults many times will sense it. They'll see, oh, Kevin's weak. They'll see me there. He's weak. We got him. So
that's what I was going to say. They can sense your weakness in a heartbeat.
Well,
it's like you're on the Serengeti and you're a gazelle.
Yeah, my granddaughter, I said, she's got my number, and now I need to change my number.
There you go.
Yeah.
So
that's it for today.
We are going to have a prayer time if you want to stick with us. If not, we believe in you.
We want to hear from you. We want to hear your stories.
If you like this podcast, please rate and review, because that's how other people can find us. And we really want to spread this message.
Father, I just thank you for all your blessings, and especially for Kevin and the work he's doing with those children. And Lord, I just pray that you would bless his work and bless those children, Lord, and just be present in their lives, and pray that they would sense your presence and know that you care for them and you are there for them, that you want to be a part of their lives and that they matter to you. And pray that we would continue to just make children matter in our lives, Lord. I just pray that oftentimes we take it for granted that, kids have parents and kids have adults in their lives, and that, we don't have to worry about it. But so many children aren't getting the adult in their life that they need, the father figures and the mother figures that actually spend time and care for them. And I pray that we would just want to be there for others and care for them and look for those kids that are lacking that didn't get good parents. And Father, I just thank you for the jobs that Kevin is doing, and that he is helping to save those kids and lead them to a better future. I pray that you would inspire him and give him strength, and I pray that he would learn to really relish his work in that. I also pray that these injections would help him to heal from the trauma that he's had, and help him to not have that hanging over him anymore. In your name I pray.
Father, I just thank you so much for Kevin's willingness to try these different things for healing, to be able to speak about the different traumas in his life. And Father, I pray that whoever's listening that has not shared their story, who has felt like it's not safe, that they might find somebody that is safe. They might find a place where they can share their story, because freedom comes as we speak the words, Lord, because until we do, it feels like it's our fault or there's something wrong with us. And Lord, if we can break any barriers here, is that telling our story is important. And I thank you that Kevin is willing to share not only his story with us, but the work that he does, and then to also be an ambassador for these procedures to show us that there are different ways to deal with PTSD, different ways to get help. And Lord, just that the hypervigilant is so exhausting. And I thank you for the work that he's doing, and I pray that you'll bless him in his endeavors. In your son's holy name, amen.
Amen.